Hello, my name is Amar Kamara, and for the skill video portion of Hostess Clinical Specialty, I will be performing the abdominal exam. The first step you want to do is wash your hands before you come into contact with any patient. This is a preventative measure to make sure there is no transferring of any bad bacteria. You want to make sure you scrub in between any crevices and under your fingernails, because this is where many of the bad bacteria can hide. After you rinse your hands, make sure you dry your hands with a clean towel. The second step is the introduction. Introducing yourself to your patient will allow them to know who is performing the exam on them. After they know who you are, you have to make sure you are treating the right patient. You can confirm their identity by asking them to state their name and birth date while you confirm it on their wrist. This will prevent any mix-ups in the hospital. This is also a great time to communicate with the patient what you will be doing to them, and also a great time for them to ask questions. The third step of the abdominal exam is the inspection. This will allow the doctor to see any visible conditions of the abdomen. You can start by looking at the eyes for jaundice. Jaundice happens when there is too much bilirubin in the blood. This bilirubin goes into the digestive tract to be removed, but too much of it can cause pains in the abdomen. Then you want to check the hands and feet for edema. Edema is caused by the abnormal buildup of fluid in the body. If it shows up in the hands and feet, it will most likely be in the abdomen. After that, you can check the abdomen for any scars, jaundice, abdominal distension, masses, stretch marks, or any rashes. They can also look for any odd movement in the digestive tract. The fourth step is putting on gloves. You always want to put on gloves when performing a procedure to protect yourself from any contamination. The fifth step is auscultation. This step is very vital because you can hear the abdominal processes and if they sound abnormal or not. To perform this step, you would need a stethoscope to listen for the different sounds. To use this, you have to use the diaphragm part of the stethoscope in 2 to 3 spaces in each of the 4 quadrants. When listening to the abdomen, you want to hear whether there are bowel sounds, if they are frequent or sparse, and if the quality of the sounds are good. You also should check for renal artery bruits, which can be the product of narrow blood vessels. Step 6 is percussion. Percussing allows for the doctor to tell the size, position, and density of an organ. To do this, you place 2 fingers on the desired area and lightly tap with your other hand. You do this around the perimeter of the organ, which is most likely the liver, spleen, or bladder. Also, when percussing, make sure you listen for when the sounds go from resonant to dull and the amount of fluid in the abdomen. Step 7 of the exam consists of the first part of palpation called light palpation. To perform light palpation, you would lightly press across the 9 regions of the stomach while asking the patient if they feel any pain. Make sure to watch their face to see if they show any signs of pain or discomfort. You also want to feel for any masses that can be caused by a cyst, benign tumor, or cancer. Step 8 of the exam consists of the second part of palpation, called deep palpation. To perform this, you would firmly press over each of the abdominal organs to see whether the size, texture, and hardness are normal or abnormal. You would also feel for the contractions of the patient when you press down, called voluntary or involuntary guarding. During deep palpation, you want to feel the liver by asking the patient to take a deep breath, and when they let it out, cup the liver to palpate it. You should also palpate the spleen by asking the patient to lay on their right side while you palpate it. Step 9 is the review. This is the time for you to update your patient on their body's current condition and go over everything you performed on them. You want to tell them whether or not they should do further testing with the results you found. The final step is to thank the patient. This is a chance for you to thank them for coming into your office that day and to urge for a follow-up appointment.